I feel that as a community, we need to have a lot more discussion about cancer, a lot more awareness, being able to talk to each other about the concerns that you have, and being able to talk about prevention, environment detection. And I'm sure you gathered by now we don't have all the answers. But it's a starting point. It's important for all of us to talk about this and to understand this. I know that as a patient, you heard about what Claire and Neil talk about, trusting yourself and knowing your body. But when you do have disease, you frequently say, or have illness, you say, where do I go to get treatment? How do I know I'm getting best treatment possible? How do I find out the information? And if you were a cancer survivor, you want to be able to know where your support system is and also your quality of life and how you can help the others. So I think since this meeting has met a lot of the goals, and we've been very fortunate to have a range of experts and individuals to help us think through this. So we didn't set up this meeting with answers, and it's not heavy on presentation science. It's really an opportunity to engage. So what did I learn from this meeting? The power of knowledge. I think you would all agree with that. I mean, it's usually when you don't know, you have fear. And when you know more, I think you feel more comfortable, at least being able to anticipate and participate. So the power of knowledge is very important, and we need to give people the information. They own the information. We've got to give them all the information and knowledge that we have around each individual's cancer. The power of science. I do think that innovation in science is a pathway for the future. If you listen to, and they were very modest, Kelly and Neil, in talking about their work, but I think some of their work are really potentially groundbreaking. And, it's been peer-reviewed, published, so, they're cautious because they say, okay, we've got some very important initial observation, we need to validate it in multi-center trial. And that's good practice. But I will tell you that I'm very excited about the fact that you can use molecular markers, molecular pathways, or biomarkers, or whatnot, to predict the disease and your disease, and perhaps to predict how you can treat it and what the outcome is. I think there's a lot of validity to this. One way or the other, we may not have all those tools, but we can have enough tools going forward for specific cancers, and that's really important. The power of personalization. You heard that discussion. How important it is to look at the patient as an individual, not as a cancer, not as a disease, and that how each cancer may be different from the other one, even though they may look the same. And so it's really important to think about that, and of course, more importantly, understand the person's background, their own individual issues, and treat them as individual patients. The power of engagement. We've done that today. And if you listen to Bill talk about power connection, the ability to bring people together, because I don't think one person can solve this problem.